The topic today is cost and pricing of plastic surgery. There are two broad aspects to plastic surgery: reconstructive and cosmetic. Reconstructive takes abnormal to normal. Cosmetic takes normal to better than normal. Insurance companies will mostly pay for reconstruction, but hardly ever for cosmetic surgery. So the cosmetic surgery now is paid for by the patient. So what should you ask for, or what should you know about? The cost and pricing is based on the plastic surgeon's fees, the anesthesia fees, facility fees, supplies, whether it's done internationally, and you should also ask about deposits, refunds, and revisional surgery. So let's break this down. First of all, non-financial considerations. You need to find out about the plastic surgeon's reputation. So Google them, go to Real Self, or go ahead and look at Yelp. Number two, look at their training and their experience. And most of all, make sure they're board certified. And lastly, it's the patient experience. How do you feel in the office? How does the staff take care of you? What is your gestalt feeling? Now let's get down to dollars and cents. The total cost is based on what part of the country you live in, because there's overhead prices in some places that are higher. For instance, beach cities or large cities have a higher cost to performing surgery or doing business. The anesthesia, is it a board certified anesthesiologist or is it a nurse anesthetist? The facility fee, how much does it cost just to run the operating room? Also special equipment, endoscopes, special lasers, special types of liposuction machine. And lastly, the supplies like breast implants or other implantable devices. Okay, one is international medicine. While there are very many qualified and good international plastic surgeons, I do not recommend international surgery or surgery that's less than a car drive away, an hour or so. Why? Think about your pre- and post-operative care. What happens if you have a minor complication you have to come in daily? What if you're overseas and have a major complication? Who's going to provide the care? Who's going to pay for it? And who's going to pay for the airplane to fly you home? Well, the average costs internationally are much less. You need to think about some of these things. In our area, we see patients that have had untold events in Mexico. Well, it's relatively close to Riverside. It still creates some barriers. What if you need a revision? Who's going to pay for that? Are you going to fly all the way there? Something to think about. Okay, so now let's go ahead and get down to the nitty-gritty of some of the things that people don't often ask about. Deposits. To hold your place, a deposit. But what if you decide not to have surgery? Is that deposit refunded? Is it applied to future? Or what is the policy? What about refunds? What is their refund policy if you sign up to do something and not everything is done, or you decide to do less? And then lastly, the revision policy. So these are all important things to ask what the costs are. So let's summarize. The cost is based on the plastic surgeon fees, the anesthesia, the facility, the supplies, international, local, or far away, and what are the policies for deposit, refund, and revisions. However, the most important thing that you should consider is the plastic surgeon himself or herself. Remember, this is your body. You need to find the best technician, the best plastic surgeon, the best doctor to take care of all of your needs. Thank you very much.